tell me, good morning. This is Ina, and you and I had the pleasure of meeting a couple weeks ago with Ken, so we could sort of figure out the best way to use your precious time. Tell me where you are right this minute.
I'm here in my clinic, where I used to work with neuromuscular disorders. Now I'm here. When you talked last week, I was in my home.
Yes, so at the clinic. So how many people are part of the clinic?
And professionals or?
Professionals.
Professional, I think 15 physiotherapists and occupational therapists, 3 speech therapists, and 2 psychologists, and
that's okay.
That's okay.
But tell me how many of the physical therapists, do you all take care of polio patients, or is that a specialty for some of you?
All of them work with, because we study at the Federal University in São Paulo, and we did a course, specialized year like this is a course, and all of them works with post-polio and other neuromuscular disorders.
So you've all been trained by a professional.
Yeah.
And yeah. So that's interesting to me. So this professional who trains you all, yes. Where did that person get their training? Do you know?
Well, when we started researching post-polio in 2001 here in Brazil, we did first of all, we worked with amyotrophic lateral sclerosis and all of the other neuromuscular disorders. And when we started working with post-polio, we started researching, but working with the patients here. At that time, they were about 45 years old. So it was, well, young, let's say this way. So we did a lot of trainings, a lot of tests, a lot of things with this to find the better way to treat. So of course we read a lot, not just trying, but reading, researching, and all of this. And I had a very good professor. She was a physiotherapist, and she was very good.
Were you surprised that there was either a lot written about it or not enough written about it when you were starting to study it?
Well, we read about it, but here in Brazil, my first specialization was about hydrotherapy. And that moment, we used to work with patients with polio at the pool, at the hydrotherapy, even without post-polio syndrome, because we had a lot of patients who didn't have the new symptoms, but they had polio. Okay, so it was population that we was used to work with. But when the patients with the new symptoms started to come, we started to research. We started to try new things with them.
So tell me, how do you get your referrals? I mean, how do people find out about you and what you do?
Well, our group, when I say we, I say our group because we are a group of therapists who work at the university. We did many conferences here. Yeah, and at 2005, 6, 7, I don't remember, we brought many researchers from the United States, from Brazil. We did a big conference at that moment to learn more.
Was it sponsored by the university?
Yeah, yeah, and the association together.
And the association.
Yeah, the Brazilian Association of Post-Polio Syndrome. This
If it's
name doesn't
possible-
exist anymore, but
If it's
it was.
possible, could you find out and maybe share the name of the people from the United States who came?
Yes.
I would love to know who was there.
Yeah. I can.
Anytime,
well,
anytime.
Okay. I can bring you all the names because I have the memorial.
Oh, that would be wonderful. Thank you.
Okay.
Good.
And this was very good for us because they wrote about many articles. They wrote very many good articles, I can say. So we brought them and learned more about it, and then we started to do our research here with our population, and it was very good to put together both the research, the practice, and all of this.
So if I called university and said, you know, I'm a polio survivor and I would like to be seen by somebody, what's the first step? Would they send me to a doctor for diagnosis?
To a doctor, yeah, to a neurologist.
To a neurologist, a muscular neurologist. And
Yeah.
do you know how they assess it? Do they have any special criteria? What do they look for? Or is it like everywhere, they rule out certain things and then what they're left with is the post-polio?
Well, when you call the university, for example, you have a consult with a neurologist. The chief here is Dr. Akari Oliveira. So after this consult, he will ask for exams or everything. Well, he's a neurologist. And then the diagnosis, yes, post-polio or no. And then we from multidisciplinary team started to work with the patient, or if the patient doesn't live near or here in Brazil or other places, we can say what they need to do or they don't need to do. This is our job here at the university. When the patient can come to my clinic, for example, and then I start to work with this patient, for example, with post-polio or not, no problem. We can adjust, of course, but we start working with the physiotherapy, hydrotherapy, speech therapy if it needs, respiratory physiotherapy if the patient needs, and all of this.
Do they have a particular amount of visits that they can have with you before they need to be reassessed? Or do you just do the assessments and keep going with them until you think that they're better and they can go out?
Yeah, the second case, the second option.
So you get to assess.
Yeah. Yes. Here in my clinic, we have a partnership with an institute that is Instituto Giorgio Nicoli, where the patient, post-polio syndrome patients, only for post-polio syndrome, we have a time of 6 months of treatment, twice a week, for 15 minutes each session. So once a week, they do physiotherapy, and the other day, hydrotherapy for most of patients. 2 of them needs respiratory physiotherapy, so they do in another day. So it's about 30 patients each 6 months.
John Nanny, do you want to ask that question that just came up in the chat? Or did you have that question?
Yeah. What is your what does the hydrotherapy involve? What type of activity?
Well, for hydrotherapy, for me, is the best way to decrease pain and start working with a function, well, trait what the patient lost. For example, I'm a patient and I'm having a pain when I walk, for example, my hips. It's common. For now, for here, people always complains about pain, hips or lumbar or feet. So when in the pool, we start, the first step is because we decrease the gravity force. So we started walking without that pressure of the gravity force. So we started working with muscles without having fatigue, the muscles who help it, for example, these hips, to stay aligned, to walk correctly. How can I say? So one leg in front of the other. We started working with muscles that are not used here outside because the gravity force don't let them work. So it's a different group of muscles that is working inside the pool. I can show you, if you can, some pictures of more or less what we do, how this works in the practice. Do you want to see?
Yeah.
Okay. Okay. A moment. I can here. Where's here? Can I here? Here I think I can put this. No, it's not here. No. It was here. I put because I know it was. Just one moment. I will find it. Here. Can you see this?
Yes.
For example, good. Let's see. It's a patient and me. So, for example, here, I'm working with this patient. He had polio in this leg, so he can go stretch and just then this, for example, doing respiratory exercises Here, this patient with this 1 kilo, for example, it's because the member doesn't stay in the pool, and so it tends to float. So that's why. That's why here stretching, for example, is a patient with post-polio syndrome. So we are stretching. Here, this patient is doing this exercise from this position to this position. She had polio and has post-polio syndrome too. So we are trying the movement to sit, but with my help and with my, I'm helping her. And in the pool, it's much easier. For example, here is another way to stretch. For example, using this, we help this to happen when people can stay. This respiratory again. This is something I always want to say. So you use this 1 kilo, for example, for this leg to stay here position. Here, this to put him, how can I say, stand. He can't be stand because this leg stays stable, more or less, but and this can. So after this position, he can walk outside the pool. He can't walk. He can't walk. So this is one situation, and this is of course these patients can walk, so the exercises are simple. This patient, she can't walk, so I'm working this control, this control. For example, she can't do this outside the pool.
Are you aware of the term called deep water running?
Yes, yes.
Is that something that you incorporate in your hydrotherapy?
Yes, when the patient can do, when they can, of course. So, and this is just an exercise. This is an exercise for this an exercise to for upper limbs, and this patient also had post-polio. Here, just to rotate the trunk from one side to another, and there's another way to stretch this patient. Well, now she can't stay seated. Now this picture is about 10 years ago, but now she are much after her time in a bed. But at that time, we used to do stretching and relaxing, and none of this with her. Now she can. And this is a relaxing moment in a pool, too, for example, for these contractures, for this, because when it stays a lot of the wheelchair, this region gets more tense. And this patient, for example, she had polio, and she has post-polio syndrome. She uses tracheostomy, and she goes to the pool. We have all of these adaptations. For example, the chair who puts her inside the pool, her ventilatory equipment, and she stays well. Of course, the water doesn't go to the trachea, for example. And this is when, for the beginning, this or how one therapist we stayed with one patient, and none of this inside the pool. These are the things to put patients, because the pool was not able for all to stay stable. So this I think is what I could say about it. But it's more or less what we used to do since 2003, 4 or 5, more or less.
I'm always surprised how few doctors here recommend hydrotherapy for exercise and for mobility and for balance and for core. I'm always surprised how few doctors recommend that here. And
I think it could be because of the weather, perhaps.
well, I don't know, because we do it indoors. We do it at a pool.
Oh, yeah.
In
Yes,
the
it's
hospital, so I don't know. So it just confuses me, because
Yeah.
I think it's an extraordinary way of.
I've been to Warm Springs in 2009, I think.
Mhm.
And I talked with 2 or 3 physical therapists at the moment, and they said that they still use to work with patients in a pool. And we talked about, I learned about many things, many good things with them. It was very good at the moment.
Yeah. John, you have any more questions in the?
Yes, somebody asked what, Carla asked, what is the brand of the weights that are used in the water?
What is, excuse me?
The brand, the type of
The
weights.
brand?
The name of the.
Yeah, the brand.
Name of the company.
I don't remember, I don't know, but I think it's a Brazilian, I think it's a Brazilian, what it calls floaty, I think. They are from, especially for use inside the pool.
Yeah,
But it's a Brazilian brand.
And I think if somebody went on Amazon, they'd be able to find it. I have another question. How do your patients manage the temperature change as they get out of the water? Carol says, I love the water therapy, but was unable to manage the cold once out of the pool. By the time I got dried and dressed, my muscles were all in spasm and I was unable to get warm. My physician insisted that I stop the therapy. Any recommendation?
Well, okay. It's a problem that we try to adjust here. Of course, the temperature inside the pool here is about 34 Celsius degree. When patients get out of the pool, the temperature, but here in Brazil, we don't have a winter, so there's a lot of difference in the temperature, but we tried here, the bathrooms are near the pool, and we had another room after going out where the temperature is getting lower, but not too low, because here in Brazil, we don't have lower temperatures as you have in the United States, of course.
Thank you.
So it can happen, but if the place where is the pool have another room where the temperature is in average between the water and outside, this contractor, it's difficult to happen the contractors, because the temperature had to be a lot low. Not from 34 to 3, for example. It's bad.
Right.
Just for a note for everybody, I'm gonna only give Tatiana questions that relate to general topics, not individual diagnosis for individuals, because it'd be very hard seeing that she does not know that person, and it'd be hard to for her to answer that question.
Okay.
Anything else over there, John?
No. Well, Dev said hydrotherapy is what started his journey to become an athlete. The same way in my situation,
Mhm.
I was losing 8% of my muscle strength every year until I started deep water running, where I get up to my neck in water and run in place where my feet are only tapping the bottom. I get the mobility, but not the pounding on my legs, and I get cardio, and that's been incredible for me. And thank you
Yeah.
for that.
Yeah.
So John, I sent you a question in the chat
Okay.
from a gentleman who's not here today.
Okay.
What are the advantages
Yeah.
of a neurophysiotherapist over a regular physical therapist?
Physiotherapist.
Physiotherapist, yeah.
Yeah. Okay. We used to our thoughts. For example, I'm always thinking of function. So to better walk, for better sit, for better eat. So it's a function. And we, neurologic physiotherapists, think this way because we can't waste muscles doing this 30 times. It's not good. So if a patient said, oh, for me, it's difficult now to catch something there. So I will try to do exercises without fatigue who can help this movement, and not doing 30 times the same because it's difficult. So we are stretching, we're going to think about the function. I think this is the main difference, because if you don't think about fatigue, pain, weakness, new weakness, we can't do a correct job. So we think about it and we create a way to achieve that function, if it's possible, of course, to achieve this function without having the symptoms. This is neuromuscular thinking of doing the exercise. I think is this. I worked with, before I started working with this, I started in common clinics that treats all kinds of patients. And here in Brazil, for example, if you say, I'm feeling pain in my knees, they say, oh, 30 times this, 30 times that, do this, do that, and for then 10 sections or 20 sections, and okay, go home. It's not this way. It's more carefully study the plan, the way to treat. I think is this. It's difficult to explain, but I think it's this.
Well, I always worry about people who are struggling with PPS and they exercise and over-exercise on land. And we who are further along know that it wears out, the nerves. And being in the water just changes everything. Every single thing. I mean, I'm walking now because I was in the water.
Yeah. Yes.
So I'm a big believer in all of that. Anything else?
Yeah, somebody said, why do you use weights? I currently use a warm water pool for exercise. I think using weights on my polio leg would hinder my abilities, increase fatigue, and make my efforts less productive.
No, because the limb, the lower limb with polio needs to stay in the deep of water to have a stability to do the exercises correctly. If it floats, it's going to be difficult to realize the exercises correctly. So this 1 kilo is just to put the limb stable in the dip of the pool.
So it's
not to use weights. It's not to use.
It's more of an issue of buoyancy.
Right, to keep the leg down.
Right.
to lick yeah.
Thank you.
Mhm. Mhm. What does Angie have to say here?
Keep in mind that most pools are used for multifunction in the US are not 34 degrees centigrade,
Oh,
which
right.
is 93 degrees Fahrenheit. To help in the transition is actually warm towel and then warm blanket until core and extremities are warmed back up.
Right, right. Our
Yeah.
pool is 4 feet of water or 93 degrees.
Mm.
Okay.
And the room is kept very warm, and so is the changing area. And then I wait before I go out into the hallway.
Okay.
Yeah.
Yeah, and John McFarland said the weights are 1 kilogram. I guess it's kilogram. I'm terrible in metrics.
Yeah.
Which equals 2.25 pounds. Sorry
But-
for my American
Yeah.
inabilities.
Right. But in the water, you just don't feel the weight of that because you're not really going up against it. You're merely just keeping your leg down next to the other one.
Yeah.
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 It works perfectly.
Yes.
Tell us what else you want us to know. Here we are, we're a lot of post-polio syndrome people here. What do we tell our doctors? What do we tell our neuromuscular docs? Do we say to them, we need aquatherapy, we need hydrotherapy? Do we walk in the door and say, you know what, the physical therapy is just not helping me enough? Can I get a referral to a pool and find the pool? I mean,
Yeah.
how we have to be aggressive in that, don't we?
I think yes, because of course it's easier for them and easier for many patients to say, oh, I'm not going to the pool, because going to the pool, you get some work to do, to work the clothes and all of this. Sometimes the weather is cold, sometimes it's easier to not go to the pool, but helps a lot. This is something I can tell you. It helps many patients here. And for example, of course, for 6 months, it doesn't solve the problem completely, of course not, but it's helping. And sometimes they do 6 months and then stay a year without doing, and then come back with pain and fatigue and all of this and work again, because it's something for entire life.
Mm-hmm.
And I help them to say, okay, you need to stop now, stop. But you have to come back, because our body asks for this, for movement and all of this. So each one has your own sequelae from polio and needs a specific treatment and specific exercises. So that's what we try to do here, to work with your clues. Say, oh, it's pain. Let's do it. Let's try to get the pain lower or get out of pain. And now you can walk better. And now you can do your things better. But it's, I think it's the better way. Of course, here we do physiotherapy outside the pool to stretch, to work with, for example, core. We can do it, of course, but it's more difficult for patients to do it. Sometimes the pain is so severe that it's not easy to do what we ask them to do. And when they are inside the pool, it's much easier. Much easier. So I think for the physician, for example, or I need this now, where can I go? Because when I talk to patients who doesn't have access to the pool, I always say, please tell them, your doctor, you need to go where is the best pool to go, where you need to be near your house. So that's how I used to talk with people, but I know it's not easy. And here in Brazil, it's also difficult. It's not
Right.
easy. For me, I put an elevator to put patients inside and outside the pool. And all of this, that here in Brazil is difficult because it's very expensive to do it.
Mhm.
So it's, I'm not saying here we have everything. No, I'm in São Paulo, in a clinic, near a hospital specialized in neuromuscular disorders. So here is one scenario, but it's not a Brazilian scenario.
Mhm.
We try to inform, to see patients online from other states. I'm trying to do it, but I still have problems here too. It's not
Yeah.
easy.
We understand. And I think the takeaway from just what you said is that we have to advocate for ourselves more loudly. You know, we have to say to the doctors, you know, I need this and help me find how to get this. Too many times we just accept what they say and we just are missing out on a lot of that. So
Yeah.
that's great.
Yes.
Okay, anything else?
Well, Minja has her hand up, or him or her, but please put, yeah, we're not taking questions over the, you know, the meeting. Put your question in the chat, please.
Okay.
Can you write it in the chat, please? Thank you.
Yeah, I just wanted to say something,
Yeah.
John, Anna, because when you and I talked with Tatiana a while ago, it was obvious that Brazil was probably advanced as far as some other countries are concerned, as far as physical therapists understanding PPS. And one of the things, the way we got in touch with Tatiana was that one of our members, Norma, who I'm not sure is here today or not, she's in Texas, who happens to speak Spanish. And so Tatiana had been working with her over the internet. Sorry, John, this is too long a question to put in the chat. So Tatiana had been working with her over the internet, and I wonder how that works when you work with somebody over the internet.
Yeah.
How do you work with somebody over the internet?
For example, when I talked to that lady, she find me here. I don't know how, but well, she find me, and we talked on the internet, and well, I heard her story and her difficulties, and I tried to orientate. I tried to say, do this, don't do that, and look for a place for you to go and talk to your physician. And all of this, I stayed, I think, 2 hours with her, and I tried to say what would be better. But it's difficult because I don't know how is the neighborhood, the place, if she has a condition or not. But I tried to do this, but she only found me, and we started talking, and I think it was good, very good. But now I don't know how she, because we only talked once, and I said, if you need me, please call me. And now she has my WhatsApp, and so we can talk. But it's the way sometimes I can do, and I did it this way. I think if I can help, I will help. If I can help someone who needs me, I will help.
Sometimes it's helpful to hear what you should not be doing.
Yes. Many times I say, you don't need to do that.
Don't
Please
do that.
Don't.
Right.
Sometimes it's the better way to advocate. Don't do this.
Luckily here in the States, sometimes Medicare will take care of the payment for this, which is how I go to the therapy pool at the hospital. And the nice part is when I have the assessment, and I have done very, very well, they say, okay, you don't need any more pool for now, but if you should find yourself weakening again, come back. And Medicare is nice. It doesn't add it on to the old visits. It resets and I come back for visit number 1. And so it's been very helpful that they have taken care
Very
of all that. And I've been going for several years now.
Okay, it's very good.
Yeah.
It's very good. Yes.
Okay.
Quickly, Medicare has also changed. Mom is on a maintenance program, so she's able to go once a week. And she doesn't have post-polio, but Medicare has changed in that.
That's good.
Yeah.
Anything else, John, before you have to leave us?
No, I'm on my way out. So Ken, you need to take over. Thank you, Tatiana.
Welcome. I say, well, thank you very much, you, for you too. It's a pleasure to talk with you, and well, for me, it's very good, very good.
Well, we got a lot of information from you, and most of it is about advocating for ourselves and making sure we get the kind of therapy that we think will help us, rather than just, you know, going to some place that's just traditional, because we are not traditional people.
Yeah. Yes. Yeah.
You know
And
that.
if you need me, I'm always talking with Ken by WhatsApp. If you need me, if someone needs me to talk, we can schedule. No problem. No problem.
Oh, thank you.
For
That's
me, it's
very,
a pleasure.
that's very generous of you. And you didn't hear at the beginning, but in the US right now, it's Happy National Physical Therapy Month. And we're supposed to thank all of the physical therapists and their assistants nationwide. And thank you for being there for the moments that help us move.
Thank you very much. In Brazil, it's the day of, it's
Oh.
a national day of physiotherapy too.
Well, we have a month. We have a month because we think so highly of you.
Yeah.
Yeah.
All right,
Thank you.
everybody all right now? So thank you so much.
Before we go, anybody who is not on our mailing list and wants to be on our mailing list to keep up with the recordings of these meetings, the scheduling of future meetings, please make sure you put your information in the chat. And we'll get you on the mailing list.
Can I real quick interject that there had been a question about doing these exercises in the hot tub? And physiologically, the way your body works is that your skin needs to go to the skin to cool in a hot tub, especially. And so it's not going to your heart where you need it, which is why we don't recommend that people even go into a hot tub after they've done any cardio or have really exercised a lot. So no, you can do stretching, light movement, but definitely no cardio.
In the interest of time, rather than putting a chat, I know Joyce has a question here.
Well, just a quick comment. If anybody in the group is going to be going to the conference in Melbourne, if you could please send me a quick email. We've applied to have a breakout session on post-polio syndrome. We won't know until December if it's been approved, but we would love for other people to be involved with it. So please send me a message. I put my message in my email in the chat. It's joyceg98@gmail.com. Thank you.
Great, thank you, Joyce. And if there's no other questions, Ina?
Nope, I'm good to go. Thank you all for tuning in today. I hope you have you took away something that will help you, because that's what we're all about. We're all about advocacy. We're all about information and resources, and we want to bring you the kinds of information that will help us all be better.